Honestly, just being able to wake up in the morning and get out of bed.
Going outside and have my son point out a plane in the sky, or a train goes by and instead of covering my ears, you know, I'm now pointing at it and excited to hear that it's coming by.
You don't really notice what you're able to do until it's taken away from you.
The patients teach me the simple things to enjoy and also not to sweat. The big stuff is, there's not much you can do about the big stuff, right?
Sometimes you have to focus on just that little thing to get them through the day.
You just make a big deal out of it because it is such a big deal, and I'll ask patients too, when the stem cells are going through the tubing, I'll tell them, because you can see little clumps of cells, and I say, look, they're coming to rescue you. And you just take the little things and you make them into bigger things, and then we'll come in and we'll go through the birthday song and let them know, like, this is a rebirth and a new start. And it kind of gives them the courage, the strength, the rejuvenation to keep going.
Happy birthday, dear Louisa. Happy birthday to you.
Bone marrow transplant's different from general oncology because we're very cure-oriented as far as taking this cancer that keeps coming back and engulfing their whole life and making things so difficult and trying to completely wash away cancer and give them a fresh start at life.
It takes a very special person to be an oncology nurse, and an extremely special nurse to be a bone marrow transplant nurse.
You either are an oncology nurse, whether it be bone marrow transplant or hem-onc nurse, or you're not.
Physically demanding, it's intellectually challenging to get these patients through this process safely.
They are compassionate, they're caring, they give 100% all of the time, and it's just a privilege and an honor to work with them.
We become very close and attached to our patients and their families.
You'll come to work and there's a point where it's not really even a patient assignment, it's more like taking care of a loved one.
My kids know the nurses by name, my husband and my mom.
Every shift that you're working, you're with the same patient, and so that allows the patient to have a trust with you and for the nurse to know the subtleties.
They took such incredible care of me. They're even better than family in that respect.
You can really tell that they, truly believe in what they're doing, and that they're, passionate about something like this.
People know what I do, and they'll say, how do you do it? Well, there's good days and bad days, and the bad days I cry, the good days I laugh. And you try to make the most of every day with the patients and make it best for them.
I think it's an honorable floor to work on because you're working with people in such a vulnerable moment.
You think of everything in your day-to-day life that you have to do to take care of yourself. They take care of that for you.
At night, at any hour, they're great human beings that you can really connect with. It was very easy to connect with these nurses.
All of us nurses are close to each other, and you give each other support.
Nurses are key to the outcomes of transplant because we have to get them through this safely, and it's powerful.
I just want to do a personal thank you to the E1 unit. Ina, Kendra, Anna, Megan, Gail, Dorothy, everyone is incredible on that unit. You work well as a team. It shows very well to us as patients. I loved how well you included my family. You do an amazing job, and I'm so honored to have gotten to meet all of you.